Canada's Chief Public Health Officer Theresa Tam cried wolf last month when she played victim about how the COVID-19 response saw her a target of online harassment, but exclusive access to information documents obtained by us here at Rebel News show that she brought it on herself. Tamara Ugolini here with Rebel News to bring you exclusive access to information documents obtained through our special website at rebelinvestigates.com. Thanks, of course, to the generosity of our supporters at home, just like you, who helps us continue to file access to information documents and government documents like the one I'm about to share with you today, which proves that Canada's Chief Public Health Officer, Theresa Tam, isn't the innocent victim, as portrayed by the Softball Toronto Star interview featured on December 22nd, 2023, last year. Titled, "She Fought Off Online Attacks as the Face of Canada's COVID-19 Response." Now, Theresa Tam reveals just what kind of toll that took on her. The article confirms that the relatively unknown Tam faced an onslaught of misinformation, of course, and threats following Canada's pandemic fumblings. In the interview, Tam notes that the knee-jerk COVID-19 reaction was the first pandemic in the social media age. That throws yourself out there as an individual a lot more, she's quoted as saying. You're exposed to anyone who can comment in the comments section. So that was tough. But our ATIP, our access to information response documents, show that Tam wanted that social media attention. And in March of 2020, as the response was ramping up and lockdowns were set to begin, Canada's Public Health Agency was spending time ensuring that Google and Facebook, now known as Meta, were directing people to their vanity website and to Tam's Twitter account directly. Interestingly, we requested this documentation in July of 2021. No extension was ever taken, and so this response was 2 years overdue and released to us a mere few weeks before the Toronto Star article was published. Look at this on page 1. Facebook asks to link and drive traffic to the Public Health Agency of Canada's web pages. Given the spread of COVID-19 in Canada, Facebook would like to start linking search results for coronavirus from Canada on both FB, that's Facebook, and IG, that's Instagram, to PHACS, that's the Public Health Agency of Canada's information site, rather than the WHO, the World Health Organization's, which we are currently doing. Would this be something PHAC is comfortable with? If yes, can PHAC please confirm that these are the right URLs in French and English? They asked. Facebook also says we'd like to start sending notifications to Canadians about the two PHAC sites in Facebook newsfeed. Should we do this, PHAC should expect significant traffic to your website, and we wanted to be sure that PHAC's infrastructure is okay to handle this increase in web traffic. On page 3, again, this is in March 2020, Google says that Canada's coronavirus page is now the first result in the information panel of the Google search page, and confirms that the Information Control Center is available to the Public Health Agency of Canada as the government deals with this crisis. This confirmation came a day after the agency asked the tech giant to do this. On page 4, strategic communicator at Health Canada, Sarah McKenzie, asks Google, could you please point to our vanity URL in all cases? And please point to Dr. Tam's Chief Public Health Officer Twitter account, as opposed to the Health Canada and Public Health Agency of Canada account. This communication began on March 5th, according to the information detailed on page 5, where Google basically pressures the agency to have information at the ready. In times of crisis, Google seeks to provide users with access to timely, actionable information to our users. Given the urgency and severity of the COVID-19 public health emergency, we are also exploring how we may be able to swiftly surface local resources from health authorities in the most affected regions of the world. Google wanted to launch these product features in the next day or two, and then they put the pressure on. Given the severity of this epidemic and the importance of communicating to Canada's population using local resources, we are hoping you can get back to us with guidance as soon as possible and within 24 hours, ideally. We greatly appreciate your attention to this issue. By March 10th, Google was sharing its work from home directives with Tam. Page 8, look at this. Hi, Dr. Tam. This afternoon, Google announced that it is recommending that all employees in North America work from home for the next month to help avoid the spread of the virus and to ensure the health of our employees. This includes our offices and 1,500 employees in Canada. And then they share a now removed hyperlink to a tweet by Sundar Pichai, that's the CEO of Google and its parent company, Alphabet. On April 2nd, page 9 of the document, Google was exploring ways that aggregated, anonymized local information that could help in the fight by creating COVID-19 community mobility reports. Tam thanked Google for this work and looks forward to using Google's tool as she decides on physical distancing guidelines. In June of 2020, Google again reaches out to Tam and Assistant Deputy Minister for Health Canada, Jennifer Hollington, to ensure Meta users only find allegedly trusted, quote-unquote, vaccine information sources. Look at page 12. I'm writing to see if the Public Health Agency of Canada might be able to recommend a trusted source for vaccine information in Canada that Facebook will start showing in a few places where users are encountering vaccine information. For example, when they search for vaccines on Facebook, when they find vaccine hashtags on Instagram, and in Facebook groups that are discussing vaccines or have been identified for vaccine misinformation. Currently, our trusted source is the WHO, and we'd like to find a local Canadian partner to provide the most relevant vaccine information to Canadians in English and French on our platforms. Specifically, would the Public Health Agency of Canada have a preferred vaccine information URL that we can link to across our platforms in Canada? I'm also aware of the Immunize Canada, and we could approach them if you think they are better equipped to be the official trusted information source. But by the end of August, this wasn't enough for Tam. On page 11, she emails, FYI, that's for your information. I comment about the need for social media platforms to do their part, promoted an email from Redacted. I know social media and internet companies have been making efforts in combating vaccine misinformation, working with CIRID, that's the Center for Immunization and Respiratory Infectious Diseases. Back pocket bullets about some of the work they have been doing would be good. I can deploy them as appropriate. Good to keep the collaboration going as a step in the right direction, while personally, I think more needs to be done. As it would go, Tam has continued with her desire for the government to control social media. She did so at the World Health Assembly's May 2022 Strategic Roundtable on behavior science for better health, if you can believe that such a thing is needed.
Science officers to see if they can help, but I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
Because nothing quite says informed choice and informed consent like controlling the flow of information in a way that conforms to the desires of a highly profitable billion-dollar pharmaceutical industry. For Rebel News, I'm Tamara Ugolini. It's becoming abundantly clear that Theresa Tam has led a disastrous COVID-19 response, aligning more with a biosurveillance state than arming citizens with informed choice. And her shilling for Big Pharma has seen the continued endorsement of both ineffective masking and still in clinical trial injections. That's why we've launched a petition at firetam.com. You can sign it. You can share it, you can support this kind of journalism, and stay up to date with the latest information at firetam.com. Thanks for your support.